I'm going to demonstrate a proper insertion of a external jugular vein cannulation. So first of all, I'm going to think about my PPE before I proceed. So I'm wearing gloves, I've got goggles, I've also got my equipment all laid out on the table here, everything I need in the EJV. I'd also think about consent, but in this situation, because my patient is in cardiac arrest, they're unconscious, I have implied consent. Otherwise, if I was going to perform it on a live person, I'd obviously ask for their consent. Okay, so the next thing I'm going to think of is having my patient in the lateral, supine on their back, with the head in a lateral position, so turned to the side, so then the jugular veins can be easily distended. Some possible complications that may arise when putting in an EJV include a pneumothorax, thrombophlebitis. It can also cause an ear or a plastic embolus, nerve damage, or it can cause infiltration in the pulmonary tissue. So that's something I'd definitely consider. And also I'd make sure that before I do the EJV that the indication for the EJV would include a cardiac arrest, and when I can't get a line in the arm, so that would be the reason for doing it, and just when we need a greater bore, so like a 14 gauge, a bigger needle. Okay, so I've got the patient in the lateral position with the head turned to the side. So 3 ways to distend the jugular veins would be performing a supraclavicular tamponade, so that's going to occlude the vein. Also, if I exerted gentle pressure on the liver, which would perform a hepatojugular reflex, that could cause some jugular vein distension, or if I got them to bear down, but if they're unconscious, obviously that's not possible, but that's just listing 3. Okay, so I'm going to move on now to performing the procedure. And these here have been drug checked. So this is my saline, my PosiFlush, that's been drug checked prior. And I've also got 3 mL of saline in my syringe, which has been drug checked too. I've also used a 20 gauge syringe for this video, but in real life I'd use a 14 gauge. Okay, so now I'm going to clean the area of insertion in a circular motion, working outwardly, just to stop germs going into the entry point. Okay, so now I'm going to take my needle out, sharps out, and I'm going to do that supraclavicular tamponade, and I'm inserting the needle in the top half of the jugular vein to eliminate the risk of a pneumothorax. And I'm also going in at about 20 degrees as well. Sharp scratch. And now I'm checking for flashback, which I have, so now I'm going to advance. I'm going to push the whole needle in about 3 mL. Now I can advance the catheter forward with 2 fingers here. And I'm still performing that tamponade, and I dispose of my sharp straight away, and I grab my lower plug. Okay, now I'm going to secure that with one strip of tape. Okay, that's all secure. So now I'm going to take my flush, make sure there's no air bubbles. And I'm just making sure that there's no filtration or swelling around the site. That's why I'm flushing approximately 5 mL. Like so. So I can't see any swelling, so I don't think I've got into any pulmonary tissue. I'd also be thinking about documenting the time that the EJV was given, and it was a 14 gauge in real life, in this case 20 gauge. Yeah, that's a correct demonstration of an EJV.